Oh,
Um, Now we're recording. Tyler,
hello.
tell me about
Um,
your synthesis project.
oh, well, hello. My name is Tyler. This is Courtney. We're just going to be discussing the synthesis project topics and why they're kind of important to us. The topic that I've decided to talk about is the relationship between type 2 diabetes and homelessness, and more specifically, the relationship of like exacerbations from type 2 diabetes related to homelessness. Um, it with AR experience, and also working in a rehab center for addiction. Um, I got exposed to this quite frequently just because they would come to us super unhealthy in the rehab center when they would get intake like A1Cs through the roof, not medication compliant, and poor dietary habits, largely related to lack of resources. And we see exacerbations in the ER all the time that have to be mediated, such as like HHS. Um, and so, yeah, I just want to talk about the fact that homelessness increases the risk of complications related to type 2 diabetes.
Nice. Yeah. Um, yeah, great points, especially the lack of resources. Um, I chose for mine, rural populations specifically. I was thinking more rural Wisconsin farmers, and just in general how they kind of view medicine. And then in particular, focus on like rural hospital closures, and how that has been shown to cause rural families to seek less medical treatment, including prenatal care and primary care, resulting in more chronic disease processes and actually more rehab uh, stays. But a lot of the rehab centers are also closing as of the recent Big Beautiful Bill. So that was also one of the reasons I chose it. But um, I mostly chose this group because it involves a lot of my family members. I'm like from rural town, Wisconsin, and I'm the only one in medicine. So sometimes it kind of feels like I'm just like preaching to um, no one who wants to listen or believe me. Um, so I just kind of wanted to get some more facts on it and just see um, how you can kind of present it better to those people.
Yeah, that's got to be hard just because they don't realize how it's going to affect them until it actually affects them and they need to go to the hospital and there's no hospital open because we're deciding to we decided that it's a sacrifice we're willing to make as a
Mhm.
country to get rid of rural access to healthcare, or at least put it at risk.
Yeah, I think it part of it too is like then their kids, because they don't have the rural closure, the rural hospital closures have happened. Their kids move into our larger cities. And I know you're an ED nurse, so you know what happens then to our inner city ratios and amount of visits that we get because we're having to take the sick ones from outside, but also um, the people moving into the city to actually be able to access healthcare.
Yeah. um a lot of this, like the topic, my topic, like particularly resonated with me, just because like I spend a lot of time around type 2 diabetes exacerbations, excuse me, um especially as they relate to homelessness, because like a lot of times like people who are unhoused or haven't had healthcare for a while don't even realize that they have type 2 diabetes, so they come in like some sort of crisis and we recognize it. And then there's the issues of in the emergency department. It's harder because I don't really see that, but I worked in inpatient rehab. um, it was actually really cool because we got to spend a lot of time, because they spent at least 30 days with us to get them adequate care, try to
Mm-hmm.
get them on a better lifestyle. I also spent a lot of time just because of this writing about this topic in nursing school, so I have some background knowledge. Like I feel like several projects I did just related to type 2 diabetes. I'm not really sure how that like fell into my lap, but in nursing school I took an interest in diabetes. So
Yeah.
uh,
Diabetes is fascinating. I feel like it affects such a wide margin of people too. So
yeah, and it kind of just like sneaks up on people without them
straight
realizing it.
up, yeah.
Yeah, it's crazy. I also just spent a lot of time reviewing articles related to type 2 diabetes and how quick it can happen, and just like the drastic statistics. that you see like in unhoused and underserved populations.
Hmm. I think that's honestly kind of probably coincides with like my thesis quite a bit, is like how often are people just not seeking primary care and then coming in suddenly and getting like, you have type 2 diabetes and you have hyperlipidemia and you have hypertension, and how overwhelmed are those rural farmers to hear that they have all these things wrong with them, where if they maybe would have just had it watched over the years with primary care, might not have happened. um yeah, so that's, no, I think that's, yeah. um I mostly started my research just online with statistics as well. A lot of it was just um, finding out about hospital closures, rural hospital closures, which as I was doing it, I was just kind of shaking. I was getting so mad. Um, and then just like discovering like the complete lack of funding that's happening, and then continuing to happen with this new bill that's passing and how that's going to just affect. And then uh, like having that knowledge, at least with my family in particular, of like they voted for that, like a lot of my family is Trump supporters, and to have them be like, this is a good thing, and it's like, actually statistically from everything I found, it's a very bad thing for you specifically. um so yeah, a lot of that. But my like um yeah, I am just, especially because a lot of the like I don't know. I'm gonna start rambling if I keep going. But
Are there a lot? Have there been hospital closures since that has passed? I really haven't done too much research, but
I saw, yes, I did see in my research that there has been over 100, and there is going to be upwards of 500 more. And I have that in my data over here somewhere. But I was like, dang, that's a
that's
lot.
unfortunate. Yeah,
um,
I mean, like, well, I can appreciate a lot of the ideas of um, of of people like voting on that side of the thing. Like, I can appreciate a lot of the ideas, but like, in my opinion, I would rather see, the misuse or whatever their argument is. I'd rather see the misuse by 100 people as long as it helps a one person. Like
yeah,
with as much money as this country spends, I think it's fine. I think it's
I
fine.
think you can handle it.
I
Yes,
think it'll be okay. Like I get they don't want the misuse of it, but I mean,
yeah. I
it's
found
just
my,
until you need it, then it's
yeah,
you
and
know.
then when you don't have it, what are you gonna do? So
Mhm.
yes, I found that statistic because is the more than 100 rural hospitals have closed since 2020. The future of rural hospitals looks bleak, and with over 700 additional rural hospitals waiting to close. One third of hospitals no longer operating in smaller American populations. Despite these, residents of the community still paying for health insurance, according to the Center for Healthcare Quality and Payment Reform. So, yeah, I remember finding that sad. But
Um, I was just trying to think about like I just put like even in my notes for this discussion, I was like I don't a lived experience with it. I just remember um this fella in particular, he came in nicest guy ever, but he was unhoused. He came in to North Star, which is the treatment center I worked at,
yeah,
um, and he's a
where is that?
bilateral. North Star's in Shakopee, but it's also
Shakopee.
got a
Okay.
location in Otsego,
I think I've heard of
Chaska.
the Shakopee one. Yeah. Okay.
Yeah, the Shakopee one's a men's treatment center, but like one guy specifically came to mind. He was a type 2 diabetic, and he was unhoused, but he had like bilateral lower extremity amputations. Like, I mean, like full, like one
The
was
whole
above the
nine
knee, one was
yards.
below the knee. His A1C was like 14 or something like that. Like, it was just like crazy,
Mm,
super, like just not controlled whatsoever. But I do appreciate like what, even though it's not what it's used for, but North Star had this policy where you could um, So you could be in the program for 18 months because you'd go to intensive inpatient and then intensive outpatient with lodging, and then they had sober housing. And this guy, I appreciate that they let him do this because they also let other people do it. But if you relapsed at the end, which is obviously not the goal, but if you
That is
relapse, you
part
could
of
start
the
over
problem, or is part of the um
cycle, but like
cycle. Yeah,
you could start over at the very beginning.
that's
And
nice. Yeah,
but he primarily used this like I don't think he ever had any intention of like truly getting sober. I don't want to accuse anybody of that, but he used it for medical, like because he got rides to his appointments and everything, and you would just see how he would he like actually started getting better with resources. So like obviously having the resources, having the structure, having a place to live, obviously,
right.
and having a diet and having access to medical providers, it clearly like mediates the issue, you
Yeah,
know.
yeah, 100%. I mean,
So
that
like
kind of even
that's
goes back to what you were saying a little bit about like I'd rather somebody game the system or like use the system to their like rather than like it not be there for one person who actually needs it, because like Loki, he did need it, like
yeah.
to your point, it made him better. Maybe he wasn't 100% sober the whole time, but he was getting healthier. Like that's kind of the point of us.
Mhm. Yeah, I mean, I don't care as long as you're
Yeah,
if you're getting better and using it for whatever you got to use it for. I mean, there's people who've used treatment centers for worse things,
right,
so
yeah, I'm sure.
it's fine. And it, my big thing is you can use the ER, the Reason, or whatever you want, as long as you're nice. As long as,
As long as you're nice, yeah,
as long
yeah,
as you're
spoken like
nice,
a
I don't
real
care.
ED nurse, my friend. Yeah.
As long as you're nice, I don't care what you're here for.
I
As
don't
long
care what
as
you're
you're
here
nice.
for. Yep. Yes. My kind of like similar, well, not overly similar, but I had a patient who that came in and they were like also type 2 diabetic, like very far along in their like treatments and care and everything. But yeah, he went 11 and a half years without seeing a primary care physician. And he was like, he had moved into the cities and was getting like public housing for his medical treatment now, but was previously in rural Minnesota. So I
Oh
think
my
it's cute that our topics kind of align.
that
But
is kind of cute. That is kind
yeah.
of cute.
So yeah, that's interesting. Um, for my informant myself, I'm gonna my cousin was kind of my like big takeaway, like with all this happening. She died in 2023, so it was before a lot of the closures happened in 2020, but this is just kind of what I think is going to continue to happen if we keep going down this route. But my cousin was a teacher, part-time bartender. She lived outside of Ladysmith, Wisconsin, and she was a 25-minute drive in to Ladysmith. Um, but she got into a car accident, and even if she would have made that drive, like if the ambulance would have made that 25-minute drive into Ladysmith to stabilize her, she was going to be either an hour and 15 minutes from the Mayo Clinic in Eau Claire, 50 minutes to Aspirus Hospital in Wausau. Both are only trauma twos, or 2 hours and 7 minutes to get to Regions, not counting um, med flight. Um, so it was one of those things where, like, like, if they could have made that, she didn't make the 25-minute drive to Ladysmith, but if she had made the 25-minute drive to Ladysmith, they still don't have the resources to necessarily like treat her critical illness is, and she would have had to just been stabilized and sent further, which is
Mhm.
even further away for her. um but yeah, that was my like reason for kind of wanting to do this, is just because like I've seen a lot of farmers on our burn unit, like a lot of people that were lucky that their injuries were not as severe and they could be stabilized in South Dakota, and then med flighted out. Um, but yeah, I can only envision that getting a little bit worse as we see more rural hospitals closing.
Yeah. I wonder how that's gonna like impact like the population of like farmers. I mean, that's such a like huge industry and probably like a really like drastic consequence. But like, like a lot of farmers are getting old or
Yep. And a lot
um,
of their kids are moving away because they don't have the access they need to healthcare and things around that area. So, yeah,
yeah, I
that's
mean, I just wonder how that's going to affect that industry or if they're just, farmers and don't care because sometimes farmers are
they
just
certainly, I will, as a family with farmers, they certainly pretend not to care.
it's like, like I don't know if they'll
Yeah.
just be like, "Oh, we'll buck up," because that's
Yeah.
kind of the attitude of farmers. So,
Yep. And I've noticed that there's like, not, I noticed, I was looking at statistics of it, and there's actually been like a huge increase in like substance use out, particularly alcohol is a big one in Wisconsin, obviously. But like in those cases getting really bad, to the point where again, I had a patient that I kind of use as an example where he was up, um, was I think he was ice fishing. It doesn't necessarily matter for the story, but he fell off the back of the car. Um, Said he was fine, but he had been drinking, and so then he was heavily anticoagulated from the alcohol. Ended up with a huge brain bleed. Had to get med flooded to us. Probably like the sickest patient I've ever taken care of. He was on 4 pressors. They were
oh
using.
goodness,
Did you know insulin can be used as a pressor?
I
Apparently,
didn't
it
know it could be used
can.
as a presser.
Yeah, apparently if you run it with D10, you can use it as a pressor for blood pressure as well, for bleeds in particular. So news to me. Um,
That's new learning today. All
yeah,
right.
but all of that just so that we could like stabilize him enough for his family to get there. And their son beat them from Florida with a 4 hour flight before they could get from southern Wisconsin to Minneapolis. So
Oh
it's
my
just again
gosh.
like even just that how far everything is. Um,
Mhm.
so we were like doing everything we could for a full day just to try to get his family at the bedside to make the decision. But
Oh my goodness.
why did
Um,
I tell you that story?
you never told me that.
No, I said, why did I just now tell you that?
Oh, I don't know. Well, I mean, to put emphasis on your point of why we need like,
That's
what is, I get what you're saying. I'm
okay,
picking it
cool,
down.
cool.
Um, so the questions that like I chose to, reflect on is like, what it's like for the unhoused population to live in our current cultural system.
Hmm.
Uh, well, right now it's not looking great. I mean, in retrospect, it really never has looked like, they have a really like tough time. If you think about
We're certainly
the
not fine
second
right
question I
now.
had are like, what are the points of stress, which I'm also going to touch on in this. But like, a lot of people don't want to interact with them. They're seen as, they're different. They don't want to interact with them. Some people see them as dangerous or you know, there's all these biases out there about homeless people, which guide people away from even just saying hello to them on the street. People walk to the other side of the street when they see them coming. It's unfortunate. They're just people. But a lot of the points of stress that they like face are you can't get a job without an address. So how do you expect to get
Yeah.
employment without an address? And a lot of the homeless shelters require you to be back in by 8 p.m. And so if you use the homeless shelter as your address, you can't get a job that is gonna because it's like 8 to 8 is when you can be out. So if you are getting a job, you have to work between the hours of 8 and 8. Um, Healthcare in general is a point of stress. A lot of them feel judged when they come in for care. Which I mean, I wouldn't want to go get care if I felt judged by the person who's supposed
No,
to be taking care of
100%.
me. Um, and just like the not knowing, like, where am I going to lay my head tonight? What am I going to eat tonight? Is
Yeah.
somebody going to steal from me? Just like the things that we take for granted, like living in house and shelter and having things at our disposal. So, they just are not privileged to that like we are. And I
Oh,
think we forget that a lot of the times that they're just people trying to make it in the world too.
yes. Well, even in like when they do come into our ED, like we're not exactly giving them um 5 star meal, like nutritious meals. We're giving them carbs and turkey. So, yeah, to your point, like if you don't know where your next meal is coming from, it's certainly not going to be a healthy meal. It's just going to be something that actually you can eat. Um,
People come far and wide for those turkey sandwiches.
I, I believe you. But yeah, no, I think that's, yeah, those are great points. Great points. Um, did you identify a gatekeeper?
Um, I guess I was kind of confused by that. I
Mhm.
just kind of
I said, I
elaborate.
think I feel very similar to that, where I was like, I don't know if there's a gatekeeper, but I do think that nurses can play a huge role in particular in mine in rural areas, because I feel like there could be more nurse practitioners, of course, like more small nursing clinics run by them, but also I think that nurses have been viewed as the most trusted profession for so long that I think if we actually sat down with patients who really doubted the medical field and like explained it in like a dumbed down or like watered down way, um, that it might actually be helpful. And I chose my explaining to my dad he hates his Eliquis that he's on after his ablation. And I was like, the doctor told him, I'm sure, till he was blue in the face. I read it in his discharge instructions about why he needs to be on it. But then he's like, yeah, I think I'm not going to take it tonight. And I was like, Dad, you're not going to like the meds they put you on if you have a stroke. Go take it. And he did. And so, like,
Mhm.
just that vibe of like, maybe a nurse just needs to sit down and be like, here's why. And we're not playing with you. Like, this is not about big pharma. This
Yeah.
is not about money or putting you on a prescription. It's because this is actually what it does in your body. Um, which I
Yeah.
think
I had a hard
diabetes,
time with the gatekeeper cultural informant, just because, like, I mean, in the unhoused population, like, that's kind of like hard to find somebody
yeah,
who
I would
just
be
wants to
curious
like
if it
chat
could
about
be
those
like,
things,
yeah, I would be curious if it could be like case managers.
or like diabetes educators, even maybe.
Boom, that's probably way better. Yeah, that's probably
Um,
way better.
because I mean, like, I guess I've never actually like sat down and spoke with a diabetes educator, but I'm sure that this is a problem that they deal with regularly. I've scheduled appointments when I worked at the rehab center with diabetes educators for patients, and
Yeah,
I mean, I just don't, because the amount of new diagnoses that happen at a rehab center is absolutely crazy
oh,
because a
I
lot
believe
of
that.
these
Yeah,
people like come in and have not seen a doctor in years.
yeah,
And so like they get diagnosed with all these like you learn about specialties you didn't really know exist, or like
yeah,
31-year-olds getting diagnosed as type 1 diabetic. Like
yeah,
what?
yep, yeah, 100%.
But
Um,
yeah, I guess that would be a good cultural informant. I just don't have like a story or anything
oh
related to
yeah,
them
but I
because I
think
haven't chatted
I
with
was
them before.
curious if you had picked one because yeah, I was kind of struggling with that myself where I was like, I don't
Mhm.
know if there's a specific informant or gatekeeper that I can think of for this. Um, yeah. Did you have anything else you wanted to share?
I mean, I guess like insights to like care expressions, like um, like practices of like I feel like in my population, like the holistic health and things, like they apply, but they don't apply. And this like culture isn't necessarily one that like holds beliefs. Like these are people from all different backgrounds and walks of life. Um, and so I think a lot of these people, like their beliefs and like what helps them is just having someone to talk to, like we're being at the health commons, like just chatting with people, like it makes their day better.
Hmm.
It's therapeutic for them. And I think over time, like even just like physical items, like the longer you're in homelessness, like trivial items become less important and more about necessities, and like human connection is like a huge necessity, and I think it's really valuable to them
Yeah,
when somebody just talks to them. And like we can definitely do that as a healthcare provider. And
100%.
it definitely relates to our nursing practice, like just how we approach them as patients and not as like less than because they're homeless. Just like chat with
Yeah.
them about who
Yep.
they are and their life experiences.
Yeah. I love that. I read a article once, I don't remember why or what for, probably for nursing school, but that like homeless people had said that they felt so deprived of touch just because like people were like to your exact point, people are afraid to talk to them, afraid to touch them. So like when I have a homeless patient, I always am like I think the shoulders is a very safe spot, but I'll like double tap, like, nope, I got you. Like, um, because yeah, to your point, I think sometimes they just need to be heard and seen and listened to and not just
And hold
um,
their hand during difficult conversations,
yeah,
just like,
yeah. Like, hey, I'm gonna poke your finger. I'll give it like I'll hold it for a minute afterwards, and like, you know, yeah,
and just like the also like being on the lookout for like other comorbidities and things that maybe not have been caught because no one knows how long it's actually been since they've seen a healthcare provider. So it's
yeah,
definitely
totally.
important to like be on the lookout as a nurse for like signs and symptoms of other chronic illnesses that maybe have gone unnoticed for a long time.
Yeah, 100%. I think that's awesome. Yeah.
Is there anything else you had to discuss about yours?
I don't really know. I went into a little bit of in-depth research on just like the in general like uh hang on. Sorry. I went into a little bit of a like rabbit hole about like just the lack of healthcare education in America and how that was a huge contributing factor to like discrepancies between rural communities and the distrust with healthcare providers. Um, and so that was interesting because none of it was like numbers, like finite, like statistical numbers. But I think we see it every day in like the mass media and everything where like you're constantly seeing, well, especially during COVID, I don't know if you remember, but I as a COVID nurse, I was like, I'm hearing from all these people like, don't get vaccinated. This is like, X, Y, and Z, and it's just getting spread through the media, and you're like, and your family is buying it and listening to it, but you're standing over there on the front lines and you're like, hello, I have this actual tangible evidence that's real and like this experience that's real and lived here. Like, how can I
Hmm.
give this to you? And a lot of it is like I wasn't able, in my experience, to like bridge that gap between their lack of healthcare knowledge and like basic biology of vaccines versus like what I was seeing every single day. But then, like I said, went into a little dive of it, and I didn't realize that 91.4% of Americans over the age of 25 have only attended high school, and 38.3% of those 91.4 have gone to college, and it's just some college. It's not necessarily that they even graduated. So I think again, I kind of hold, and I know the another statistic was that like the reading level in America is generally at a fifth grade reading level. Um,
I didn't
yeah.
know that either.
So
Oh
that
my
was all
goodness.
stuff where I was like, we really, maybe nurses in particular, have like a really good chance to like be that go between the scientific data and like what's actually happening to you and why, um so that maybe that distrust just gets kind of left behind a little bit. But yeah, I don't know, I think as long as they can do it non-condescendingly, because certainly not going to work with a farmer if so
Farmers are their own breed.
they certainly are, yeah. I had an emergency room patient today who he was literally doing heavy lifting and harvesting yesterday and then intubated coded today for heart failure. I was like, why were you working so hard yesterday if you didn't feel good?
Oh goodness. Well, all right, just to keep the recording not going over our time limit, if
Yeah,
we don't have anything else, I think we'll just stop it here.
sounds good to me. Thank you for chatting.
Hmm.